Medicare plans in Georgia. Medicare plans in Georgia. That's what we're going to show you here today. Oh, yeah, I just noticed I didn't shave this morning. Sorry, guys. Usually I like to get a fresh shave on my face here, but just bear with me if you would. Just first day of school, so we're running around like chickens with our head cut off. So I want to go through Medicare plans in Georgia, and I'm going to show you what I did here to get some information on that. I thought it was actually pretty interesting. So if you like what we talk about here at Heritage Wealth Planning, don't forget to subscribe. Subscribe down below and hit the bell to be notified for future content. Let me get my trusty pen. So let's dive into this. I think it's pretty interesting, actually. So basically what I did, went to Google, and I said Medicare plans Georgia. And so I started scrolling around, and I'm looking at what you look at all these ads. A couple things. See that right there, cost per click? That means there's a lot of people spending a lot of money to advertise for Medicare stuff. And here's a ARP. Here's, I don't even know what that, MedicareAdvantage.com, MedicareSolutions.com, Medigap.com. Again, if there's a .com, those are commercial enterprises. I got no problem with profits. Don't bother me at all. But just it's not they're going to probably gather your information, and then they're going to send you to an insurance agent. That might not be what you're looking for. If you keep going down, you got BlueCrossBlueShield.com. We know they provide insurance, health.us. So anyway, a lot's going on here. But and there's Medicare.gov. That's kind of not a bad place. Medicare.com. That's pretty ingenious, actually, that these guys were able to get the Medicare.com URL. That was smart thinking. All right, so what we're going to do is we're going to go to this Blue Cross Blue Shield one as the first one that came up. And I'm familiar with Blue Cross Blue Shield, and ironic that they got their little logo there, too. That makes it feels a little bit more secure. And, again, this is just specific to these guys. This is exactly what I did. All right, so I typed in Medicare plans in Georgia. First thing that came up was Blue Cross Blue Shield, and this is where it took us. Does not know anything about these plans. I'm not licensed to sell them. I am just going off what's the public information that's out there. And we already looked at this one right here, just the episode I just did. So that's all I'm doing. I'm going off public information. So look at your own stuff. So anyway, Medicare Advantage Plans Part C in Georgia. So remember, Medicare Supplement or Medigap Plans and Medicare Advantage Plans Part C. All right, so you got A, hospitalization, the building. You got B, the services and skilled nursing care to some degree. Then you got C, the Medicare Advantage plans, and then you got D, which is the dental or prescription drug coverage. However, I'm not all that interested right yet in solely Medicare Advantage plans. I am more interested in the shopping the plans that they have. So let's look at this here. And what's going to happen is they'll share with us a way we can kind of put some numbers in there and see what kind of premiums they are, because I think that's of interest, actually. How much it costs for these various plans. All right, so Anthem, Blue Cross Blue Shield, we're going to hit click a plan. And we're going to say we're in 3004, and we're going to say we're in Fulton County, and we're going to say we need coverage for 2018, and we're going to say our date of birth. Where does it say a date of birth? So we want to go to Medicare Advantage plans. Okay. And we said our date of birth was 1958 to put us, when did I say 1958? 1955, something like that. But we said our date of birth is going to be 65 in October. So basically 3 months in advance of when you want to enroll in Medicare. That's what you should do. 3 months of advance of the date you need to enroll in Medicare, you really need to start crunching some numbers. All right. So they got 4 Medicare Advantage plans. They're designed to help you save money with low or no monthly copays, premiums, and deductibles. You can keep up to your budget without sacrificing coverage. And so here's the HMO and no monthly premium. So what happens is the Medicare, Centers for Medical or Medicare Services, CMS, Center for Medicare Services, they actually pay Blue Cross a certain amount of money. So per head, they get paid per head. So Blue Cross or Anthem says we get 8,000 million heads. We get paid $50 a head. That'll give us, $48,000 million or whatever it is. And so we don't have to charge a premium because we know for a fact if we get this many heads, then we're going to make a profit. All right. So now this is an HMO. So obviously, if you're familiar with HMOs, there are some negatives on that. You got to stay in network and all that. Out of pocket max, in network was out of pocket maximum, not out of network. So scratch that. I was getting ready to say out of pocket maximum was only $4,900. Like wow, or out of network maximum was only $4,900. Like wow, that's pretty good. But again, all Medicare Advantage plans must have an out of pocket maximum, and so in network, your out of pocket maximum is $4,900. You're not paying a monthly fee. Now, I don't know first idea of what this one is relative to these other ones down here, because remember, there are 4 Medicare Advantage plans. So you got one with no total premium. Yeah, at most you're going to have to pay $4,900 if you stay in network for out-of-pocket max. I don't even know if this includes Part D. It doesn't say there, so I'm not sure if it does. So you'd have to look into that some. Oh, here we go. So if you want, dental and vision, that's not Part D, but if you want dental and vision, you got to pay $37 a month. That might be something to look at. All right, so here's HMO SNP. Don't know what SNP stands for. Again, no out-of-pocket, no monthly premium. Here, out-of-pocket max in network is $6,700. So obviously there's a difference between the two. Meta Blue Plus and Meta Blue Dual Advantage. I don't know. You'd have to look at that for sure. This is something about Medicaid. You must be eligible under the state's Medicaid program. Okay. So Dual Advantage is a health maintenance organization plan with Medicare contract and a contract with the Georgia Medicaid program. So there you go. I did not know that. I just read it. I'm just curious. They have what do they say on this first one, actually? Oops. Here, Meta Blue Plus, a Medicare Advantage plan, HMO with a Medicare contract. Okay. So here you go. So this is why the out-of-pocket max is a little bit higher. Imagine because you're signed up for Medicaid as well. But again, I don't know. It does include dental, drugs, hearing, silver sneakers, and vision. That's pretty good. All right. Well, this one, benefits include drugs on this first one too. Okay. So I guess if you're in HMO, they give you a lot of incentive to sign up with HMO and that no premium, and you get your drugs and all that. So that's a little bit. But then why they optional supplemental benefits, if that includes that, why you get that, I don't know. So you'd have to look into that. Then we got Meta Blue Essential. All right, so that's essential because it says essential. Out-of-pocket max is $6,000, and it's a Medicare Advantage HMO with a Medicare contract. I don't know what the difference are. Why one costs $42 a month with a $6,000 out-of-pocket max, or one costs $0 with a $4,900 out-of-pocket max. You would have to look at that. I just don't know. And then last we got 5-star rated Medicare Advantage plan PPO. That's what a lot of people like, the PPO. And it's $57 a month, and their out-of-pocket max is $5,900, and then in-network, out-of-network is $10,000. So the out-of-pocket max that you'll pay in any given year is $10,000. And this does include drugs, vision, dental, and hearing too. So that's pretty good. So hearing, I know I have some hearing issues myself, and but I don't get why they got the package down here for. I guess it gives you a preventive dental, maybe just gives you more add-ons or something like that. I don't know, but anyway, so it gives you more add-ons for an extra $27. I guess I'm assuming. So anyway, what you see there is you guys goes from 0 to 42 to 57 if you want the PPO. So in Fulton County, you go 0 to 42 for HMO. To 57 for a PPO. So that's the prices that you pay for Medicare Advantage, all right? And you got 4 options. Now let's go to supplemental plans, which are the Medigap plans. Here's date of birth, and we're going to say 10/15/1958, and we're going to say it starts in September. I'm just throwing these out there. That's not me. Here's the confusing though. It says your total monthly plan premium is $1,296. It's not $1,200 a month. I'm telling you, it's I guess you divide that by 12. I saw that, so you got to be kidding me. That's like more than a mortgage for the Medigap. That would not make sense. So it's I don't know what I guess you divide that by 12. So $100 a month or something like that. And that's Plan N. And then we have Plan A, which is $1,300 a year. And then we have Plan G, which is $1,400 a year. And then Plan F is going to be more expensive because there is no, I guess, co-pays and deductible. I don't think there's a deductible. I forgot. But Plan F. So in Fulton County, Georgia, you got it goes from $1,300 to $2,000 basically for your Medigaps. All right, so that's your supplementals. Gap. I'm just writing this down because we're going to do some cost comparison actually. And let's go Plan D is your prescription drugs. And prescription drugs in Fulton County, Georgia, it goes from 78, and again, I'm not even looking at what is included here. I'm just looking at the cost. To 119, I think it's 187, 181. So we got 78 to 181 is what it costs in Fulton County, Georgia. All right. Now let's go back here. We're going to help me find a plan. I want to show you. Yeah, let's get back out of Fulton County. And this is still got, yeah. So what we want to do is see if we can't get, we're going to go to Cherokee County, and we're going to view all plans. Now, the reason I want to bring this up because it's specific to your zip code. So Cherokee County only got 2 Medicare Advantage plans, where Fulton had 4, and that's an HMO and that's a PPO. So in Cherokee County, you got the Medicaid one. Remember the SNP? I'm not sure what SNP stands for, but you have the HMO Medicaid one. It does include Medicaid in here. And then you have the PPO at $57. So the same price for the PPO as it was in Fulton County, but it doesn't have the other 2. So then they're pretty interesting. Now let's go to Medigap. Say the same thing. Date of birth. We're just going to run the numbers again. And again, this is all public knowledge. I'm not sharing with anything that you can't have access to. And Medigap policies are the same 1236 to 1260, 1344. And so it's a little bit cheaper in Cherokee County because it was 1968 for the F. I think this one was a little bit more expensive too for the G in Fulton County. So not significantly more, but a little bit cheaper in Cherokee County. But then you only have 2 Medicare Advantage plans. Part D, you have 3 plans here. I imagine the same thing. 78, yep. 18 to 57 to 181, to 119 to 181. Yeah, so it's all the same there. So that's Cherokee County. So isn't that kind of interesting? So now, let's see, if you go to help find a plan, I guess we got to go home here. And what we're going to do is view all plans, and we're going to go to Forsyth County and see what they have. So in Forsyth County, they got 3 Medicare Advantage plans. All right, interesting, huh? And again, they have the HMO, the Medicaid one. Looks like that's across the board. They got the PPO at $57, which is the same as both the other counties. And they got, I missed one. And they got the HMO one for $42. All right, so there you go. And that's the same thing they had at Fulton County as well. So that's interesting. And let's go here, and let's see what the prices on these guys are. And on these guys, we got 1236 Plan N, yep. 1260 Plan A, 1344 for G, and again a little bit cheaper on F and G than in Fulton County, but roughly the same as Cherokee County there. So let's try something else. You ready? I'm going to type in 04107 or for 108. That's where 04108. That's where I was born. Cumberland County, Maine. So listen, I'm just curious. Let's see what the good old state of Maine has for Anthem, Medicare Advantage, and Medigap policies. It'll be interesting to kind of price compare. Let's just think you're in Maine and you're moving to Georgia. I don't think many people move the other way, but just it'd be interesting to find out, would it not? All right, so let's view all plans, because you might say, man, I'm getting out of Maine because it's too expensive, or I'm getting out of Georgia. I mean, I don't know. But they do have 4 in Medicare Advantage plans in Cumberland County, which is where Portland, Maine is, by the way. And the price is here again for 0 for their HMO. And that's just a Medicare contract. I bet this is their Medicaid. Yep, here's their Medicaid, HMO Medicaid. So we got $6,000 out-of-pocket network, $6,000, out-of-pocket max, $6,700 out-of-pocket max. So a little bit higher out-of-pocket max in Maine on these HMOs. Let's see. Meta Blue Choice monthly premium is $2,200 or $22. All right, so that's out-of-pocket max is $5,500. Out-of-pocket max or out-of-network is $8,500. And you have to run these numbers here. And then you have this guy here. Was that the 5-star? Nope, they don't have their 5-star up here. Then you got their PPO, which I thought was their 5-star, and that's $93 a month right there. So that's not cheap. Out-of-pocket max 6 and 10. So there you go. So that's interesting. So they got a pretty significantly higher cost in Maine than they do in Georgia for their out-of-pocket max. For their monthly premium for their Part C plan, and a higher out-of-pocket max too, if I'm not mistaken. So again, I'd want you to look this up yourself for sure, but that's pretty interesting. So let's go over the Medicare supplement. Boink. And just to give you a gauge of the difference in cost, because these things are going to, all right, yeah, so plan A. So, yeah, it's now making it more confusing. Let's have my trusty old calculator someplace. Oh, man, yeah, right here. All right, sweet. So their plan A is 145 times 12. Oh, that's significantly higher than it was in Georgia. That's $1,740 a year. Their plan N is 145. And then their plan G is 185. Oh, yeah, that's $400 more a year in Maine than it is in Georgia. And that's not a whole lot more than that. That's because in Georgia, if I'm not mistaken, that was like $1,300. Wow, that's $1,000 more a year. Is this one right here? That's $1,900. Yeah, so they're 210 times 12. Yeah, you're paying $600 a year more in Maine than you are in the great state of Georgia. That's that can add up, my friends. That can add up for sure. Let's see what the Part D plans are. 73. Okay, that might not be 94. That should be like 119. Okay. Well, it looks like those are cheaper, actually. The Part D looks like these are cheaper because Georgia's 78 was the lowest and 181 was the highest. And here's 148. All right, so interesting. So Maine's got a cheaper Part D and a higher Medigap. And it looks like the Medicare Advantage plans were actually, I think that's cheaper, right? Look at the PPO, 93, and I can't remember. Maybe it was, I got to go back to Georgia. So the PPO in Maine is 93, and the PPO in Georgia was what? Let's go back. So let's go back to home. We're going to say we're in 3004. That's Fulton County. Oops. And what was the PPO on the Medicare Advantage plan? So let's see what this shows up. So in Maine is $93 a month. And then in Fulton County, Georgia, it's view all plans. Medicare Advantage plans. Yep, that's what we want. And here it was, well, that's interesting. So the Part D is cheaper in Maine. Their PPO is much more expensive, almost double actually, and pretty close, 40% higher. Almost double, yeah, absolutely. But yet their Part D is cheaper. Their Medigaps are much more expensive in Maine than Fulton County, Georgia. Yeah, the whole point about this: know what's state or not state, the zip codes. That way you can plan them and price them accordingly. I mean, literally, if you're looking to say we got to retire at someplace, you need to look at this stuff to get a gauge of the cheaper ones. Now, can this stuff change? That's one thing with Medicare Advantage and Part D. The benefits and all that changes all the time. They can't just change it on you, though. They have to change it on the whole group. And that's, with any kind of insurance, they can't just change it on Josh. They got to change it on everybody who's in that cohort, if that makes sense. It was interesting to me. I hope this helps. I'm going to interview Jay again, J.O. We're going to talk about Alaska, Arizona, Alabama, and Arkansas on Thursday for the podcast, which I'll put up here on YouTube as well, some of the ins and outs of all four of those states. And Jay did say a couple of those states are pretty expensive, so it'll be interesting to find out. But there you go. That's some look into Blue Cross Blue Shield, their Medicare Advantage plans, their Medigap plans, and their Part D prescription drug plans, which you'd want to get one of these plans most likely, or else you're going to have unlimited out-of-pocket max. And for financial planning, we don't want you to have an out-of-pocket max, an unlimited out-of-pocket max. That could destitute you for sure. So don't forget to subscribe. Down below, hit the red button for subscribe. Don't forget to hit the bell to be notified for future content. As always, always comments are welcome. I like to hear comments. And then don't forget to thumbs up. Thumbs up always help me because YouTube says, oh, this guy is generating some good feedback. Let's show this video to other people. And then if you have don't forget to go to the blog at heritagewealthplanning.com and sharing the episode. So if you want to share this with somebody, man, by all means, do that as well. The more the merrier. And we'll see you next time. Thanks, guys.